Hello, my name is Dr. Yael Halaas. I'm a board-certified facial, plastic, and reconstructive surgeon in New York City, New York, and I'm speaking today on combined energy-based treatments for cellulite. Why does simultaneous application matter? Some disclosures. I am a speaker for Thermi, Venus. I am part of the Speakers Bureau, and I have stock options in Venus. I am also a speaker for Allergan, BTL, Hydrofacial, InMode, Candela, and Evolus, as well as a consultant. So energy combination, the solution to cellulite. Approximately 80 to 90% of women suffer from cellulite. And just to review the grading system, there's grade 0, no dimpling when pressure is applied. Grade 1, dimpling appears with the pinch test or muscular contraction. Grade 2, dimpling is visible when standing, but not when lying down. And grade 3, the most severe, dimpling visible when both standing and lying down. Hard cellulite, dimpled, hard to the touch, may be sensitive or painful. Collagen fibrosis, poor lymphatic indicative of poor lymphatic system. The body part affected could be on the buttocks or upper thighs, and often seen in post-pubertal women. Soft cellulite is dimpled, soft to the touch, excessive fat or poor lymphatic system, often seen on buttocks, thighs, arms, or the abdomen, and often seen in women age 30 or older. The causes of cellulite are enlarged fat chambers in the hypodermis, applying pressure outwards between interlobular spaces. Collagen fibers remain rigid, pulling inwards against outward pressure, causing a dimple. The loss of skin elasticity decreases resistance to internal outward pressure. This, combined with poor blood flow and accumulation of metabolic waste in the interstitial spaces. And you can see this here in this diagram. What are some of the current cellulite solutions? There are invasive procedures that are needle or light-based. And although these can be highly efficacious, only 1 or 2 treatments are required. They, however, have a long downtime, up to 2 months, which can have a lot of bruising and risk having a lot of an irritated patient waiting a long time to actually see the results. There's also an extensive risk of injury or inflammation. There's a lot of non-invasive procedures, such as mechanical massagers or RF heating, with no downtime and very little risk of serious adverse events, but they are less effective and many treatments are required. And patients can grow frustrated by the upkeep. Let's discuss some novel non-invasive solution. Specifically, we're going to discuss the simultaneous application of radiofrequency and targeted pressure energies. Both are proven effective technologies. This approach targets the 5 causes of cellulite simultaneously. Higher efficacy is ensured by the synergy of both these energies. A previous veterinary study showed a higher efficacy of simultaneous application over just consecutive treatments of either of these energy types. And we're specifically referring to thermal monopolar RF and mechanical targeted pressure energy and the combination of both. What's some of the clinical evidence? Let's look at the cellular reduction on the thighs and buttocks. 30 patients given 4 treatments with 3-month follow-up. Ultrasound showed increased skin thickness, reduced layer of fat chambers, and smoother boundary between dermis and hypodermis. Thermography proved increased homogeneity of blood supply. We had a 93% visible reduction of cellulite and a 2.2 centimeter average thigh circumference reduction. You can see the results here at the 3-month follow-up. When we looked at abdominal skin laxity treatment in women post-vaginal delivery with a controlled study with 43 patients, 4 treatments, evaluation at 3-month follow-up, you had a 91 improvement in viscoelasticity, 86% visibly improved skin elasticity, a 1.43 thigh circumference reduction, and a 90% satisfaction with treatment result. If you look histologically, there's a 2-arm study treated by simultaneous emission of monopolar RF and targeted pressure energy. Arm 2 was treated consecutively, targeted pressure energy after the RF. The simultaneous arm showed profound improvement in connective tissue when compared to the consecutive treatments. They had a 59% higher increase in collagen, 64% higher increase in elastin, and a 44% higher increase in dermal thickness. Both applications showed similar level of adipocyte size reduction and increasing in the number of blood vessel in dermis. And here you can see control and simultaneous below. An IRB trial of radiofrequency and targeted pressure energy for cellulite had 30 women with cellulite grades 2 through 3. 4 treatments, 1 to 2 per week, each lasting 15 to 24 minutes, depending obviously on the size of the treatment area. 86% of the photographs showed significant improvement in the treated area. 83% of the subjects reported improved appearance of the cellulite. 80% were satisfied with the treatment results. 87% of the subjects reported improvement in appearance of the treatment area. Let's look at some photos. Patient results at baseline and after 4 treatments. Obvious, clear results. Again, after 4 treatments, obvious improvement in thighs and buttocks. More severe gradations of cellulite. This is just after 3 treatments. 4 treatments, posterior thigh. 4 treatments, abdominal laxity. Conclusions. The combination of RF and targeted pressure energy appears to be a highly effective and promising approach in the treatment of cellulite. Clinical studies show the superiority of simultaneous application over consecutive treatments. The treatment results in high patient satisfaction. Further research is necessary to investigate the potential of this technology. Thank you for your attention.